Last week, Robert F. Kennedy Jr. announced that they'd be cutting about $500 million into research for mRNA vaccines for diseases like COVID. He made the announcement on X via a video post. And even though the video is just about 2.5 minutes long, there's a lot to unpack there. So my stat colleague, Anil Oza, is joining me today to help me do just that. Anil, thanks so much.
Of course, good to be here. Like you said, this video is really short, but I think it's really interesting in that in it you can see very clearly the way that Robert F. Kennedy Jr. and the Trump administration at large are really warping scientific norms and in some ways the scientific world order of who are we listening to from the scientific community and whose words are we just sort of ignoring.
So what was the significance of this post on X last week?
Yeah, so like you said, it cancels $500 million worth of grants, which in of itself is pretty significant. And as our colleagues and others have reported, there are quite a lot of falsehoods in this video. And I think you can see very clearly that this administration has platformed a lot of people that were COVID contrarians or people that spread sort of ideas that ran against the scientific consensus during the pandemic, and in some ways downplaying the risks of COVID.
So what we're going to do is I'm going to actually just play the video. Like I said, it's a short video, it's 2.5 minutes long. But as we go, Anil's made some annotations, and we're going to just stop as we go and kind of like break down certain aspects of it, certain points he made, more or less just like add a little bit of context to the clip. So we're just going to start from the top.
Sure.
Hi, it's Robert F. Kennedy Jr. here, your HHS secretary. At HHS, we have a division called the Biomedical Advanced Research and Development Authority, or BARDA. BARDA drives some of our most advanced scientific research. It funds developments of vaccines, drugs, diagnostics, and other tools to fight emerging diseases and national health threats. Over the past few weeks, BARDA reviewed 22 mRNA vaccine development investments and began canceling them. Let me explain why. Most of these shots are for flu or COVID, but as the pandemic showed us, mRNA vaccines don't perform well against viruses that infect the upper respiratory tract.
Why don't we pause there? Yeah, so as he said, BARDA canceled all these grants that had to do with flu and COVID. And he says that mRNA vaccines don't really work well against viruses that infect the upper respiratory tract. But there are multiple studies, including one from just a couple of weeks ago, that point to these vaccines really benefiting people, saving a lot more lives than they are harming. And so I think as you go through this video, this is sort of a common theme of Kennedy's rhetoric, even before he was HHS secretary, is that he's inflating the risk associated with these vaccines, but sort of downplaying also the risk of COVID, sort of saying that they maybe are, these vaccines are not as necessary as, you know, others would paint them out to be.
Gotcha. Yeah.
mRNA only codes for a small part of the viral proteins, usually a single antigen. One mutation and the vaccine becomes ineffective. This dynamic drives a phenomenon called antigenic shift, meaning that the vaccine paradoxically encourages new mutations and can actually prolong pandemics as the virus constantly mutates to escape the protective effects of the vaccine. Millions of people, maybe even you or someone you know, caught the Omicron variant despite being vaccinated. That's because a single mutation can make mRNA vaccines ineffective.
Okay, let's stop there for now. So there's a couple of things going on here. For one, he uses this term called antigenic shift, which is usually something that's talked about in the flu literature, not with relation to COVID. And so there are these two terms, antigenic drift, which just means as a virus mutates and it's getting further and further away from the thing that you create a vaccine on, that vaccine will become less effective because it's slowly mutating away from what you were preparing the vaccine and subsequently your body for. But antigenic shift is a much more abrupt thing. And so with flu, that means that two flu viruses combine and they form a radically new virus that researchers aren't familiar with, that your body obviously doesn't have the protection for. And so that's a really concerning thing for flu in particular. And that's one of the reasons that we update flu vaccines so regularly, and we're doing so with the mRNA COVID shots. But this isn't really a term that researchers use to describe COVID. It's just not something that comes up in the literature. But I think this is not something that well-established researchers in this space talk about. But it is a really common claim among people that are COVID contrarians and people that 4 or 5 years ago were not really household names. They were not prominent in the fields of vaccinology or epidemiology, but these are people that are now in the highest levels of government. So even a couple of weeks ago in the New England Journal of Medicine, Vinay Prasad and Marty McCary wrote a piece about how they were going to think about mRNA vaccines, and they do talk about antigenic shift. Interestingly, when they talk about it, they don't really cite any literature, they don't reference anything, which I also think is something that you see in this video. Is Kennedy says they reviewed the literature, they made up this decision that these awards were not worth the money that we were spending on them. But until they were pressed by reporters, there was no study they pointed to, there was no data they publicly talked about. And so that was true also of the New England Journal piece, where they don't really cite where that concern is coming from. Was there a study that really made them worried about this? Is there a piece of data that they're worried about? And even going further back, this is something that Prasad has talked about, who throughout the pandemic was sort of a COVID contrarian. Obviously, he recently was made the head of the FDA Biologics Division and then was ousted and then over the last weekend was brought back. But just to say that he is sort of at the top levels of this government, as is McCary, who's the head of the FDA. But even beyond these folks, Robert Malone has talked about the idea of original antigenic sin being the reason that mRNA vaccines don't work. And this has to do with this idea where if you vaccinate against one virus, that is like the only thing that your body is primed to fight against. So as a virus mutates, your body is less and less prepared. And he has used it to sort of argue that people should just get infected with the virus when they get it, and that way it protects them with whatever is the latest. And
he was just appointed to ACIP, is that right?
Exactly. Yeah. And so a couple of years ago, he was not someone in the establishment, but now he is one of a handful of people that Kennedy has selected to decide vaccine policy in this country. And so this idea sort of is consistent with some of the things that he was saying. And so even beyond these people, during the pandemic, you saw Florida organize what they called the Florida Public Health Integrity Committee, which was a panel of people with public health expertise or credentials that used it to argue against vaccination. And once again, these are people that maybe weren't super popular then, but Jay Bhattacharya, who's now the head of the NIH, was there. Tracy Beth Hogue, who is now also in a top position at the FDA. Martin Kulldorff, who is the chair of ACIP. These people were all there sort of casting doubt on the efficacy of COVID vaccines and why we were requiring them. And in one clip, they specifically talk about this idea of antigenic shift, where one of the panelists, Brett Weinstein, talks about how these COVID vaccines could be driving variants that would subsequently lengthen the pandemic, make more people sick, and like not preparing them as much as the sort of mainstream, as they would call it, are arguing to people.
Mistaking antigenic shift with antigenic drift. Now, do people that you've talked to, do they think this was like a conflation that was done by mistake, or do you think it was like maybe he was misspeaking, or is it just sort of like he kind of just had two things just kind of mixed up?
Yeah, I think it's always hard to tell with this administration what they're thinking when they do some of these things, and I guess the only way that we would know is that they talk to us. But I will say that I think part of this larger pattern that we're seeing is that Kennedy and Bhattacharya particularly really lean on using the language of science to justify what I think a lot of people would call, not scientifically backed. And I think this is also an example of that, right? That antigenic shift sounds like this scary term, sounds very scientific, and in some cases, maybe people won't even look beyond it. But I think they're using that to sort of say, like, ooh, look at this. This is something that we should be concerned about and, take these products off the market.
All right, so we have about a minute left in the video. Let's see what else RFK packed in here.
Absolutely.
The same risk applies to flu. After reviewing the science and consulting top experts at NIH and FDA, HHS has determined that mRNA technology poses more risks than benefits for these respiratory viruses. That's why, after extensive review, BARDA has begun the process of terminating these 22 contracts totaling just under $500 million. To replace the troubled mRNA programs, we're prioritizing the development of safer, broader vaccine strategies, like whole virus vaccines and novel platforms that don't collapse when viruses mutate.
Okay, why don't we pause there? Yeah. So I think this is another statement that you can kind of see who has Kennedy's ear. So he mentions there that the mRNA platform is troubled, it shouldn't be trusted yet. and that they're prioritizing whole virus vaccines. And this likely is a reference to a project that has been championed by Matthew Memoli, who is the deputy director of NIH, and in the interim of the Biden administration and Trump appointing Jay Bhattacharya, he was leading the NIH. And not a lot of people know who he was. He was kind of a low-profile NIH flu researcher for a long time. But really what catapulted him into this position was throughout the pandemic, he was a critic of Anthony Fauci and of the way that the Biden administration put in vaccine mandates. And people think that's sort of what got him up there. During the pandemic, Jay Bhattacharya sort of called him very brave for taking this stance. And earlier in this administration, a couple of months ago, he and his colleague Jeffrey Taubenberger, who is now the head of NIAID, which is the Infectious Disease Institute at the NIH, it was reported that they had been given also $500 million to study whole virus vaccines. But I think what was really notable to people at the time that reported on this was that it seemingly didn't go through the normal peer review process, that it was just something that Memoli pitched to RFK Jr. to sort of get his support and get that funding. And so it's hard to know whether the fact that that was $500 million and Kennedy is now canceling $500 million, if that is sort of a one-to-one trade or if that just happens to be a coincidence. But I think you can see that, you know, before this administration, Memoli was pretty low-key as a scientist at NIH goes, but he was sort of elevated to this position seemingly because he sort of adhered to some of the ethos of the Trump administration. And I think in these decisions, you can see that he has RFK's ear, right? That like he is defending this project. He's saying that, well, mRNA shouldn't be trusted, like this is the way to go. And not only did that project not really go through peer review, scientists that spoke to the Wall Street Journal and the Atlantic and others that reported on it at the time said that like this project really wasn't that innovative. It wasn't really the cutting edge.
But it seems to me that like a whole virus vaccine or just sort of like a universal vaccine that like one shot would, you know, protect you against a whole bunch of different things. Right. I mean, that seems like an admirable goal. But like how practical is that? Like, is that something that like we might actually see would now that it's being funded at this level?
Right, totally. Like a pan flu or a pan virus vaccine is like the holy grail of some of this research, right? Like this is something that you want. You want to minimize the number of shots people have to get, how often you need to update it. But even in the days that followed after this video, RFK, I believe when he was in Alaska, said something about having a vaccine for the whole phylum of viruses, which means that he was sort of saying that you want a vaccine for all viruses that exist on Earth, billions and billions and billions of viruses. So I think, you know, even though like what he's saying here sounds really good, he doesn't really have command of the science, which I think is pretty interesting given like in this clip that we just watched, he just prefaced it with like, oh, we went through the science, we've made this decision based on the research. And this is something that if he had been briefed on that, like maybe that, you know, wouldn't have slipped through, that you'd want a whole phylum vaccine, because there's no way that if you can't develop a vaccine for all flu viruses, there's no way that you're going to develop a vaccine for every virus that exists on Earth right now.
And you mentioned earlier that mRNA has other uses beyond just vaccines for diseases like COVID or the flu. What other type of things that could mRNA be used to treat?
Yeah, so something that people love to talk about and something that's being researched actively is its use for cancer vaccines. And this is something our colleagues reported about last week, that even though none of those contracts were hit in this cut that Kennedy is talking about, obviously this isn't the same ecosystem of research that if you're cutting work into mRNA as a therapeutic, it's not going to help that line of research. But I think even this administration recognizes that directly attacking something that could just be a cancer treatment or a cure for certain kinds of cancer is not sort of politically viable. So over the weekend, Jay Bhattacharya, who, like I said, is the head of the NIH, went on Steve Bannon's podcast and was talking briefly about this decision and why BARDA would cut all of these grants. And he sort of said at one point that mRNA is promising as a technology, but isn't ready for prime time, I believe was his phrasing. But then he goes on to sort of say cancer is like another topic. And I think he says like, we can talk about this later, but doesn't really go on to talk about it. And I think in that you can see them wrestle with the political liability there. I think when you're talking about mRNA vaccines for COVID or the flu, you can sort of say like, you know, maybe the risks for these vaccines are really bad and like the sickness that you're risking is not the worst. But I think to try and say that about cancer is much harder sell, right? Like it's much harder to say that the side effects from these vaccines are worse than cancer. And so I think in that answer, you can sort of see them dancing around that question because it may be a little more difficult to sort of wrestle with some of those concerns that these funding cuts could jeopardize a really promising treatment technology.
Yeah, that's interesting. I mean, because I feel like everyone, almost everyone has had COVID or the flu at some point or another, and also knows someone that has had cancer. And I think so. I think that just like is from people's personal standpoint, right? It's just like, all right, like here's one thing that I'd deal with some side effects for, and there's another thing that I might not, right? Is that kind of the thinking?
Yeah, exactly. I mean, I think with the sort of vaccine skeptic playbook, right, is to inflate the risks of a vaccine and downplay the risks of an illness. And with something like flu or COVID, where some people can just get it and it's really mild, it's easy to do that, right? It's easy to say, if people are having heart attacks from the vaccine, maybe you don't want it. But I think it is much, much harder to say that about cancer because, like you said, so many people have it, and it's tragic whenever anyone has it and requires a lot of treatment. It can be fatal in some cases, and so it's much harder to go down this route of questioning whether it's worth a vaccine for something like that, as opposed to having a vaccine for COVID. It's still really important, but it's easier to sort of cast doubt there.
Like whole virus vaccines and novel platforms that don't collapse when viruses mutate. Let me be absolutely clear. HHS supports safe, effective vaccines for every American who wants them. That's why we're moving beyond the limitations of mRNA for respiratory viruses and investing in better solutions. Thank you.
All right, that does it for the video. But I just have to wonder, what does that mean? Like that's $500 million is a lot of money, and what does that mean for research institutions that were doing work into mRNA?
Yeah, so I think stepping back for a moment, I think there has been this year a lot of fracturing and a lot of strain put on the relationship between the NIH and the federal government and research institutions, right? Like you've seen grant terminations kind of come out of nowhere. You've seen other things just sort of change the language of grants and things like that. And I think that has sort of strained the trust that institutions have in the NIH and the federal government. But I think this particularly holds for places that are doing research that is not in the purview of this administration. And I think now if you are a university or a company that is doing research into mRNA, which, just a year ago would have been touted as this huge success, as really promising, as something that should have been lauded, right? Investing time and space and infrastructure, training PhD students in this area. I think now institutions kind of have to look at that almost potentially as a liability, right? Like if you're applying to the NIH for grants on mRNA, you almost have to worry that, even if the NIH initially signs off on a grant, could it just be terminated later as part of this sort of larger political scheme that's going on? And so I think, yes, this was a big cut in of itself, right? And the affected institutions and companies are hurting because of it, but I also think it sends a chilling effect to whether institutions pursue this research.
Anil, thanks for joining me in my dining room. And if you enjoyed the video and found it useful, please consider subscribing. It's a little click, but it's a big deal for us. And we'll see you next week. Same stat time, same stat channel.